tiny electrical signal no one can feel is what keeps your heart beating every second. And when that signal goes wrong, your life can be at risk within moments. The test that captures this hidden activity is called an electrocardiogram, or ECG. An ECG is a simple, non-invasive medical test that records the electrical activity of the heart over time. Every heartbeat begins with an electrical impulse that travels through the heart muscle, causing it to contract and pump blood. An ECG picks up these signals and displays them as waves on a screen or paper, allowing doctors to see how the heart is functioning. There are different types of ECG used in medical practice. The most common is the resting ECG, performed while the patient lies still and relaxed. Another type is the stress ECG, also called an exercise ECG, where the heart is monitored during physical activity like walking on a treadmill to assess how it responds to exertion. There is also the Holter ECG, a portable device worn for 24 hours or more to continuously record the heart's activity during normal daily routines. ECG is widely used in hospitals and clinics for many important reasons. It helps doctors evaluate chest pain, detect abnormal heart rhythms, monitor heart conditions, assess the effects of medications, and check overall heart health. It is often one of the first tests performed when a patient presents with symptoms related to the heart. So how is an ECG done on a patient in the hospital? The procedure is quick, painless, and safe. The patient is asked to lie down comfortably on a bed. Small sticky electrodes are placed on specific areas of the chest, arms, and legs. These electrodes are connected to an ECG machine using wires. The machine records the electrical activity of the heart for a few seconds, while the patient remains still and breathes normally. For a stress ECG, the patient is connected to the machine and asked to walk or run on a treadmill while the heart is monitored. For a Holter ECG, the electrodes stay attached, and the patient carries a small portable recorder while going about daily activities. The ECG produces a tracing made up of different waves, including the P wave, QRS complex, and T wave. Each of these represents a specific phase of the heart's electrical cycle. Doctors carefully analyze these patterns to identify any abnormalities. ECG can help detect a wide range of heart-related conditions. These include arrhythmias such as atrial fibrillation, heart attacks, reduced blood flow to the heart known as ischemia, enlargement of heart chambers, conduction problems, electrolyte imbalances, and signs of previous heart damage. Although ECG is very useful, it may not detect every heart problem, especially if the issue is not present during the test. That is why doctors may combine it with other investigations when necessary. The good news is that ECG is a powerful, quick, and accessible tool that can provide life-saving information about your heart. If you experience symptoms like chest pain, palpitations, dizziness, or shortness of breath, do not ignore them. An ECG could be the first step to protecting your life.